As a female, I know that there is a lot of suffering, emotional and physical suffering that one can be suffering from in silence. So I always feel like it's very, very important to target these points because a lot of times we are suffering in silence and we don't even speak up. So it's always good to reach out to people, letting them know that we hear you, we know what you're going through, and we're here to help. Okay? So, the reason why I decided to talk about weight loss or obesity management is this. For the past few years, Health Canada has been putting obesity under the category of chronic medical condition. So when we're talking about obesity now as a chronic medical condition, it's not just about feeling or like looking better, it's about feeling better. It's about how do I feel? Why do I need to manage my weight? Is it just because I want to fit in a nicer clothes? Of course, we all want to fit in nicer clothes. We all want to look better, but we need to have a wider vision. Like obesity management now is becoming a huge topic. We started to understand that there is so many factors that can affect our weight. It's not just about what we eat. There's so many factors, just like Debbie said, menopause that can be a big influence, which we will get into details. Okay, so why obesity matters? Obesity is a chronic medical condition that can be a root cause for so many other medical conditions. When we are able to correct obesity, we're not just correcting how we look, we are actually minimizing or decreasing our chance of getting so many other conditions that's directly linked to our weight, like blood pressure, diabetes, heart attack, stroke, and a lot of cancers that's actually directly linked to the obesity. Okay? Let's see. So, breaking the cycles of diet and the math and the quick fix. Okay, so this is what we all want to do. Like, I want to lose weight. I want to lose the weight all today. I don't want to wait till tomorrow. And unfortunately, it doesn't work that way. Why? Because it took you years to be able to put on this weight. So there is no way you can lose the weight overnight. And the other fact is the faster you lose the weight, the faster you will put it back on. So what we try to do here is we don't just try to help our clients to lose the weight as much as we try to help them to change their whole lifestyle. Why? Because I believe that the best diet on earth is a diet that you can maintain. If I'm giving you a meal plan and I'm saying, okay, you have to follow this meal plan for a few weeks and then come see me in 4 weeks' time, I'm expecting you to lose whatever number of pounds, you're gonna follow the meal plan, you're gonna lose the weight, but what's gonna end up happening is you're gonna stop the meal plan at one point and then you're gonna put it back on. In my opinion, this is not a very successful way of managing the weight because it's only providing you with a very, very temporary relief and things will go back to being worse because usually when we get into this yo-yo weight loss, we're losing the weight and then we're putting it back on, losing the weight, putting it back on. That doesn't work. And you probably will agree with me because I'm sure that a lot of you already has went through that. So changing our eating habits is just one of the solutions we need to offer, but it's not everything. So when I see anyone come here for our weight loss program, we talk about what we eat from the first minute they wake up in the morning up until they finish their day. We talk about when we eat and we talk about what we eat and we talk about how we can change your lifestyle to make the weight loss journey successful, not only for a month or two, but we're talking about long-term changes that will actually reflect on our general health. So the impact of age, hormones, and lifestyle. There's so many factors that can impact our weight. So there is so many factors, chemical factors that happens in our body. It's not just about everything that goes in our mouth. But you probably notice that after the age of, I will say 35, 40 at the maximum, if you eat exactly the same food and the same portions that you used to eat before, what's going to happen? We're going to put on the weight. So in order for you to lose the weight, it becomes even more challenging because that means you need to not just eat the same and you're not allowed to change your eating habits for a day or two. You actually have to even eat much less. And it keeps going down, like you have to keep eating much less in order for you to be able to maintain your weight. And in order for you to lose the weight, that becomes even more challenging. So what can we do in order to overcome all of these hormonal changes? And what can we do to overcome all of the unwanted fat distribution that's happening to our body? This is what we will try to cover on today, okay? So common challenges in weight loss, there is definitely so many challenges in weight loss. The first one is slow metabolism of age, okay? So as we age, like I just mentioned, as we started to age, especially after the age of 35, 38, 40 at the maximum, our metabolic rate goes down so much. And one of the biggest factors that impacts our metabolic rate is our levels of GLP-1. So GLP-1 is this hormone that goes to our brain and it tells our brain that I'm not hungry anymore. I'm not craving food anymore. So when we have this GLP-1 telling our brain that I'm not hungry, then that means I'm not eating that much and I'm not craving in the evening. I'm not hunting to this food that I know it's not healthy, but I still want to eat it. And most importantly, it also affects our metabolic rate. So it's also asking our brain to burn the extra calories when we eat them. So imagine with me that is a GLP-1 goes from this level, for example, and it starts to decline gradually. What's gonna happen? We're gonna start to feel more hungry, so we're gonna eat more, we're burning less, and we're craving more. How will that reflect on our weight? So GLP goes down, and of course the weight will go up. Part of it is just happening in our brain because we're craving more and we're burning less. Another thing, of course, is emotional eating and the craving and the stress triggers. So one of the materials I love to share with my clients when they come here is different. So it's called identifying your high risk time. Identifying your high risk time is very, very important. Why? Because it's much, much easier to deal with a problem when we identify where the problem is happening. So when I give this to any of my clients, I always say, you have probably been here, but if you need any of these materials, we have it all here in the clinic. So we will definitely be more than happy to share everything with you. Okay? So identifying your high risk time is a very crucial material. The reason being is we will be able to deal with the problem in a much better way if we know where the problem is happening. So here in this page, this is usually a homework that I give my clients. So I always say, when you go home, I need you to start bringing your thoughts into this piece of paper. And you need to be completely honest with yourself. You don't need to make up anything. When do you get this high risk time? So basically high risk time, just for you to know, is a time then I feel like I cannot control my eating. I'm craving. I really want to eat something when I know that I'm not supposed to eat that. So where are you at that time? Who are you with? Who's accompanying you? And how do you feel? Am I bored, stressed, mad, sad, happy, celebrating? Am I busy? Am I hungry? So all of these questions, you need to circle them and you need to know, why are you reaching out for this food in particular? Why am I reaching out? How do I feel now? Where I am? Who is accompanying me, what I want to eat. So all of these questions, and how often does this happen? So does it happen every night? Does it happen maybe on the weekend? Does it happen when I have a friend over? So once I'm able to figure out where the problem is happening, I can work on it in a better way. Maybe I can change the settings a little bit. Maybe I can have prepared the healthy snacks for myself and for my guests. Maybe I can limit that for maybe a weekend family movie night instead of every day. Maybe I need to change the settings, and I will talk to you about shopping because that's also another important part in the talk today. But having these sheets at home and writing down your thoughts will help you to deal with the problem in a much better way. Stomach fat in abdomen, arms, thighs, and back. So these are all hormone-related fat. So we all have to agree that through the ages, we also have a lot of hormonal imbalance, and this hormonal imbalance can definitely affect how we look. So if you ever had kids, you even have like more imbalances and you have a lot of hormonal changes. If you never had kids, you will still go through the hormonal imbalance, but maybe it will take you a little bit longer, but it will happen to everybody. And unfortunately, female gets affected even more. So we end up with the unwanted pockets of fat around our stomach, the love handles, and the arms, the inner thigh. We can also get the cellulite, and this is all hormone related. So what can we do about that? We will definitely discuss that in details. So we will be discussing how to get rid of the fat permanently and how to tighten the fat cells. Okay, so fatigue, brain fog, and low energy, these all can affect our weight. When I'm always tired, when I'm always fatigued, when I always feel like, oh, I can't move, that unfortunately can cause a lot of people to be stress eaters and they end up eating more. And that gets you into this vicious circle because when you eat more, you become even more fatigued, and then you want to get more food in to give you some energy. And then most of the times when we're feeling this way, we don't make good choices when it comes to the food. So we get into this vicious circle that's very, very hard to break. Okay, so what can we do about that? Let me talk to you a little bit about inflammation, and I will also talk to you about what we do in order to help our clients to get over that. So the first thing is what we eat is definitely affecting our energy level. It's also affecting our inflammatory markers, mainly the sugar. So the sugar, I always tell my clients when I see them here, we all like sugar, we all like the sweet stuff, but you always need to look at the sugar equal inflammation. When we started to look at it this way, we will look at it differently. So when you see this nice cookies or when you see this nice cake, yes, we can eat it every now and then. But if this is something that I'm reaching out to every single day, maybe I need to revisit this area and look at it differently. So sugar is definitely a biggest inflammatory initiators in our bodies. So when we have the food, when we have the food that is full of sugar, what's gonna end up happening is it will stimulate our insulin very, very high. And when the insulin is high, it brings with it a lot of other hormones that can affect our energy. Mostly the cortisol hormone. It can definitely increase our estrogen levels, especially when we have more fat cells. So that would even make us to make more fat. So one of the things we have to do is we have to play around with our hormones with our diet. So the first thing, of course, will be taking out the sugar from our diet. And by the way, if you stop the sugar, especially if you stop it all of a sudden, you're gonna get withdrawal symptoms for the first few days. And looks like a lot of us had that before. So you get the headaches, you feel cranky, and that's because sugar is actually addictive. So when you stop the sugar, you definitely get withdrawal symptoms, but it's good for you to go through these withdrawal symptoms for a few days. And then what's going to end up happening is you will notice that your craving to the sugar is going so much less. You're not craving the sugar as much because your brain will start to forget about it. Your brain is not constantly asking about the sugar all the time. So I always say our brain is like a little baby. When they cry and you give them what they are looking for, what's going to happen next time? They will cry more because your brain knows that the more they cry and you give them what they are looking for, they will get what they want. What you need to do if you are disciplining your own child is if you are seeing that this thing should not be given to the child, we should say no and stick to our word. Because next time they will understand that when mom says no, it means no. There's no point of nagging and there's no point of screaming. So this is exactly what our brain does with us. The brain wants this. We need to say no, and that's it. Okay? One of the biggest tips I find that it helps me even on the personal level is brushing my teeth after my last meal. When I brush my teeth, that tells my brain that I'm done for the day. There's no more food getting in. That's it. So it makes this fight between you and your thoughts much easier. One thing that we also love to offer is B12 shots. B12 shots are amazing in terms of helping with the energy because a lot of times when people try to cut down on their calorie intake, they will feel so tired. So one of the biggest thing I actually was amazed with is when we started this weight loss program over a year ago, clients who were getting these shots on a regular basis, not only they were able to lose the weight faster because it increases the metabolic rate and the MIC component in the B12 shots we offer also helps a lot with the fat metabolism. But the most important thing for me was it's the first time for me to lose the weight and have better energy. So this for me was like a big reward, seeing that my clients are not just happy with the weight loss, but they are also happy with their energy. Not only with the energy, but also increasing their immune system and having a lot of other benefits that can reflect on their body, like the glutathione boosters, for example, and the IV therapy. So we're gonna just have a little bit of a break here, and we're gonna use these questions just to discuss more things, okay? So first the question, skipping meals help you lose weight faster. What do you guys think?
No.
Okay, I agree with you. So organizing our meals, I will say, instead of skipping meals, we need to organize our meals. Our body is not designed to be eating 24 hours a day, but also we're not supposed to be starving, or like starving ourselves is different than skipping meals. Okay, so we need to organize how we eat. I agree with that 100%. Carbs are always bad for weight loss. What do you guys think?
No.
Yeah, I agree. So it depends on what carbs, right? Like if we're talking about candies and cookies, the answer is definitely yes. But if we're also talking about complex carb that can also have some nutrients, that's also very important for our metabolism, right? And giving us the amount of fibers and the amount of nutrients we need. And strengthening training helps with fat loss. What do you guys think?
Yes.
100%. And hormones play no role in weight gain. Okay, so you answered it all right, which is great. So definitely hormones are the biggest part to play a role in the weight loss. Okay, lifestyle and prevention. So let's talk about balancing and restrictions, okay, and the key building and blocks. So I wanna share with you this one here. This is what I always share with people when they come to our clinic, and probably everybody here has seen this before, but I would like to repeat it again. So we have this pamphlet. By the way, we started to have our own now, so if you never had the printout, please pick up yours before you leave today, okay? And you should also have it here. So I usually say this is how your plate should look like, okay? So this is how a healthy plate should look like. So we want to have a lot of vegetables here, and different vegetable colors means different nutrients. So we definitely want to have a lot of these vegetables here. Not so much fruits, and preferably berries. Why berries? Because berries are definitely have the low glycemic index, so it doesn't give us a lot of sugar. When it comes to proteins, always think about protein, not only meat and chicken. There is also a very good sources of protein, like it can be a perfect and excellent way of introducing good amount of protein to our body. We also don't wanna forget about the tofu, the beans, and also there is a little bit of few nuts here, and I will talk to you about the nuts later on. And the other thing is we don't want to see any simple carbohydrates on our plate. So all of the carbohydrates you can see here is all complex carbohydrates, no simple carbohydrates, and all of these carbohydrates are mostly full of fibers. Okay, so no white rice, no white bread. We want to have something that has a lot of fibers. Why fibers? Because fibers delay the absorption of the sugar. So when we have a lot of fibers getting into our body, even if there is carbohydrates component to it, it will delay the absorption of the sugar. So we will prevent this sugar spiking that will give us the insulin spike. So it's all about how we can control our insulin. Okay. Of course, drinking water, that's another very important thing. We want to drink a lot of water. And on the sheet you have here, you will also find a good options for non-carbohydrate and carbohydrate options. So this is all here for you to take home. Another one that I also love to share is that portion. So how much do I need to eat for every single meal? Okay, so let's agree that we're gonna eat 3 meals a day. We're not skipping meals, we're eating 3 meals a day. And how much do we need to eat per every single meal? Okay, so the vegetables here, we definitely can eat good amount of vegetables. When it comes to protein, we need to eat good amount of protein. So this can be like a good like a couple of eggs, like for example 2 or 3 eggs. It can also be like good amount of chicken breast, for example. Like there's so many options you can definitely do when it comes to protein. Fruits, that much, not too much, not like a big bowl of fruits. So that's a big challenge I find. And of course the amount of fat has to be this much per meal. So fat is definitely good fat. So when we're talking about good fat, that can be like coconut oil, avocado oil, olive oil. It can also be some nuts, and it can also be avocado. One of the good tricks I wanna say here is good fat is actually very important to tell our brain that we're not super hungry. That's another good one. Why? Because when your brain is super hungry, this is when we make bad choices. So, for example, I know that I'm at work, I only ate one meal, and I know that by the time I make it home, I will be super hungry. It's a good idea to take something or to eat something that's gonna be very high in fat before I make it home. Usually it takes about 20-25 minutes for your brain to know that you're not super hungry. So your stomach communicates with your brain, tell your brain that I'm not super empty. That takes about 20-25 minutes. So if you really want to tell your brain that I'm not so hungry, that has to be 20-25 minutes before you make it home. And one of the good options you can do then is gonna be definitely having a good amount of nuts, because nuts is full of fat, so it goes quickly to your brain, tell your brain that I'm not super hungry. Try this and let me know if this helps. But I always say don't go home when you're super hungry, because this is gonna be the time when you're not really thinking straight, when you're not making good choices. So we want to avoid that from happening. We want to prevent that from happening. Okay. Anti-inflammatory diet and metabolism. Okay, so we all agree that sugar means inflammation. So when we talk about anti-inflammatory diet, that means we are talking about mostly something that doesn't have any simple sugar, something that has a lot of fibers. So even if there is any, excuse me, if there is any sugar included, that will definitely be delaying the absorption. So here is a bit of the ideas for the anti-inflammatory diet. If you guys want to take a screenshot at any time, or if you want to have any of these slides sent to you, please let us know. We will be more than happy to share. And this whole presentation will be uploaded to our YouTube channel anyway, just in case you miss it for whatever reason, or if you want to go back and watch it later on. Okay. One of the things that we do here is we always offer this drink that has the green tea. It always has the cinnamon, the ginger. So you can basically make your own drink at home, and you can have those anti-inflammatory things in it. You can add the turmeric, you can add the beets, milk of settle tea. That's amazing for, of course, the liver. We talked about the nuts and the olive oil. Leafy green vegetables are amazing as a good source of fibers. And usually when we change our eating habits a little bit, we might end up being constipated. So that can definitely be a perfect way to avoid constipation, the green leafy vegetables. Now, when it comes to nuts, I just have to say that do not eat the nuts from the bag. That's a big thing. Do not eat nuts from the bag, okay? So what we need to do is we need to have our shares from the nuts, which should not be more than this, just few nuts. Put them here, and the bag has to be put away in a very, very far cabinet. So we're not reaching back to this to this bag.
Not your personal bag.
No, absolutely not. So I was talking to one of my clients about this, and then she said, "Oh, I always have those like plates that has a bit of nuts everywhere in the house." I'm like, "This is a very bad idea. Please don't do this. You want to put it away, because when you have it in front of you, what's gonna happen? You're gonna be snacking all day long, and you're not even wondering how much you snack on." That can be very dangerous. So I'm like, this has to change. We need to put this away and have a little bit, and then everything else has to be put away. Okay? So meeting time, portions, and being mindful eating. Okay, so one of the things I love to share with my clients when they come here is the intermittent fasting. The reason why I love intermittent fasting is for so many reasons, but I will try to share with you a few of them. First of all, when you're doing intermittent fasting, you're not starving yourself. You're actually regulating your meal time. So that's a good way to tell your brain. Remember, we were just talking about telling our brain and how we can communicate with our brain that we are going to change our eating habits. We're going to be healthy moving forward. So intermittent fasting can be a perfect way, even if you want to start with intermittent fasting, like let's say 3 times a week. If you feel like, oh, I cannot do it every day of the week, that's completely fine. You can do it 2 times, 3 times, and then you can adjust it based on how you feel. But intermittent fasting is the best way to correct insulin resistance. And you probably all heard about insulin resistance. Everybody's talking about it now. And insulin resistance is the first step before we develop diabetes. So if we do not take it seriously when it comes to insulin resistance, what's gonna be the next step? Diabetes. So who wants to go this way? Nobody. So when we fast for a period of time, that will trigger our insulin to go so low because there is no sugar to stimulate the insulin release. So what's gonna happen when the insulin goes so low? The sensitivity of the insulin receptors will start to improve. Excuse me. Why did we have the insulin resistance to begin with? We developed the insulin resistance because the insulin is always very high all through the day because we're eating and snacking all through the day. So the insulin is very high, and the insulin is trying to communicate with the cells through something called insulin receptors. So what's gonna happen when the mom is always yelling at home? The kids don't listen anymore. Probably we all had this experience, right? Why? Because she's not effective anymore. She's yelling all the time and nobody is listening. So that's exactly what's happening. This is the easiest way to explain what insulin resistance means. The insulin is always high and nobody is listening. The receptors becomes very resistant to the insulin because it's high all the time. And what brings the insulin high all the time? The food. We're eating all day long. So when we have the insulin resistance, that means the insulin is trying to bring the sugar into the cells so the cells can develop the energy and nobody's listening. So the sugar is circulating in the blood, cannot get into the cells. So we're tired, we're exhausted, we have this brain fog, we're eating the food and we don't feel like we're getting the energy from the food. And why is that happening? Because nobody's listening to the insulin anymore. The insulin is no longer effective. So what do we need to do? We need to adjust our diet. So when we go through prolonged fasting time, and when we say intermittent fasting, we don't mean that you are cutting down on how many calories as much as you're controlling when you're eating and the quality of the food you're eating. This is the two main things that we need to focus on here. Okay, so when we go through prolonged period of fasting, the insulin will start to go down very much because there is no sugar to stimulate the insulin. So the sensitivity of the receptors will start to be corrected. The other thing when we're doing intermittent fasting is this. When we are hungry, and I know that I'm only eating 3 meals a day, I'm not snacking anymore. What's gonna happen is I'm gonna actually eat a real meal. So if you look at your normal day, the problem usually is not the meals you're eating. Where is the problem coming from? The snacks that we're eating all through the day. So if I am preparing my meal to have what we just discussed here, the protein, this one, remember. So if I'm preparing a meal that has all of these nutrients and I am limiting my food to 3 meals a day and I'm cutting down the snacking and I'm taking away the sugar, that means I'm taking away the inflammation. I'm eating an actual meal instead of eating croissant and chocolate bars as a snack just to feel like I'm getting something in or I'm getting some calories in. And at the same time, I'm improving my insulin resistance, which is very, very important for my general health. And at the same time, I'm also improving the fat distribution. Why? Because we just agreed shortly before that insulin is so linked to so many other hormones that can actually have a big impact on our fat distribution. Mm-hmm. So why is that important? When the insulin goes down, that can also bring down all of the stress hormones and the estrogen and all the other hormones that is contributing to why we are building this fat around our waist and in the unwanted areas that we are building the fat on. And so once we're able to go through the intermittent fasting, you will notice that you started to have better energy, you started to lose inches, and you started to feel better, generally speaking. And one of the things I love here and I will love for everybody to do today is the body composition machine. we will give everybody today a complimentary body composition analysis today. So with the body composition machine, it tells you exactly how much fat do we have. And when we talk about the fat, we break it down into visceral fat, the superficial fat, the total body fat. We also give you the amount of visceral fat, which is very, very dangerous. And I think I talked to a couple of you here about it. So the amount of visceral fat is directly linked to our longevity, which means the lower visceral fat we have, the higher longevity we will have. So that's also like it's good to know about that, because we definitely want to work on the visceral fat. So the visceral fat is basically the deep fat that's deep inside our stomach, and this is the one that is very dangerous. Why is the visceral fat dangerous? Visceral fat is dangerous because this is the one that's deep inside. It's covering our organs, it's pushing on our blood vessels, it's affecting our organs function. And who's being bothered by the visceral fat? Nobody, because we don't see it. It's so dangerous, but nobody is being bothered by the visceral fat. So how can we target that? Definitely our diet and the timing of our food, but also I love the glutathione shot, because glutathione shots is mostly to target the visceral fat. This is the best thing to cleanse and to detox the visceral fat. Plus, of course, the glutathione shot is great to increase our immune system. It's also great for the skin. So it's great for so many other factors. Okay. So we have the visceral fat, and we also have the superficial fat. The superficial fat is a fat that we can pinch between our fingers, and this is the one that bothers everybody. Why does it bother us? Because we can see it and we can feel it, and it's bothering our clothes. So which one should we target? Both. And a good thing about our program is we actually help you to target both. So we target the visceral fat through the glutathione shots and the glutathione IV, but we also help you to get rid of those superficial pockets of fat here through the injections we do that permanently break down the fat cells, and also through increasing your metabolic rate, which will be the MIC shots, which helps a lot with the fat metabolism and increasing your metabolic rate. And we also do the laser and the radio frequency that will help to break down the fat, as well as fighting the skin. A very important point I want to mention about the fat cells is this. When we lose the weight, we don't lose the actual fat cells. This point is actually very tricky here, because a lot of people actually don't know this. When we lose the weight, we only lose the fat in the fat cells. So imagine if we have 100 fat cells, okay, and those fat cells are so big because we have that much fat in our body. So when we lose the weight, we don't lose the fat cells. We only lose the fat that's inside. So the fat cells will shrink. So we will look better, which is amazing, correct? But what's gonna happen when we stop losing the weight? It's gonna swell away. And most of the time, this yo-yo movement for the fat cells makes the cells very unelastic, like it loses the elasticity. Same as when you have a balloon and you blow the balloon and then it like inflate, deflate, then it becomes very like lax. So for that reason, when we lose the weight and then we fill it again, then we lose the weight and then we fill it up again, what happens to the fat cell? It becomes so much bigger. Mm-hmm. And this is why a lot of times when people lose the weight and then they put it back on, they always feel like they are getting bigger compared to before. What we want to do instead is we want to break down the fat cells and permanently lose it. Why? Because we are not losing the actual fat cells when we're losing the weight. When we're losing the weight, we're just shrinking the fat cells. So this solution can work only temporarily, as long as we're keeping our weight up. But what's going to happen when we put the weight back on? It's going to get worse. So what I would love to do instead is I want to do the lipolysis injection that goes right into the fat cells and burst them. When we burst the fat cells, what's going to happen? We lost the fat cell permanently. So even if we put on the weight, we're going to make new fat cells, which you don't want to do. But the fat cells, once you lose it permanently. How can we do that? We can do that through the injection, which is very safe, by the way, is the deoxyfolic acid and the phosphatidylcholine injection. These are I will say, transmitters that we already have in our body to break down the fat cells when we eat actual fatty food. We also do the laser that's not only breaking down the fat cells, but it's also tightening the skin, because once we lose the fat cells, we don't want to have hanging skin. We want to have tightened skin, and we do the same thing with the radio frequency. So this is a very good point to get rid of the superficial fat cells. And how can we get rid of the visceral fat cells? Glutathione injections and changing our eating habits. And the glutathione IV is amazing, especially for people who drink every now and then. Glutathione IV is like a game changer. Any questions so far? You guys are good?
Mm-hmm.
Do we have any questions from online?
Yeah, we had one a while ago. Give me a second. I don't know her how to pronounce her name, but she says, how do you assess hormonal imbalances? Do you run blood or saliva or urine tests?
So we definitely do HRT. So when we do the HRT assessment, we do that through the blood work. We can also do the urine test. But I mean, for somebody who's already 45 or 50 years old, if she's only looking to lose the weight and she's not looking to go on HRT or hormone replacement, we don't have to assess her hormones, because we know by this age she already have the hormonal imbalance anyway, and you can definitely see it on her body. But if you're talking about HRT, yes, we definitely do the blood work for that as well. So strengthening exercise is a very, very important part that I always touch base on. And we have a lot of materials that's talking about that too here. Physical exercise is very important to maintain our muscle mass. So as we age, we also lose a lot of our muscle mass. And talking about the HRT, by the way, one of the hormones that I always recommend for ladies as part of the HRT is the testosterone hormone, believe it or not, because testosterone is the best hormone to help not just with the sex drive, but also to help with maintaining our muscle mass and bone mass. And that's one of the main reasons why people end up with the weak bones and the osteoporosis, because we always have very low testosterone, but after the age of 40, we all have very undetectable level of testosterone. So that's just to add to the HRT component. Okay, so muscle, I just have to explain something here. Don't think, you have a question, Mary?
I do.
Yes.
Okay, you're saying that about the testosterone, but what if you've had a hysterectomy and you're over the age of 60 and they say you don't need any more hormone shots or anything, you don't take care of those hormones anymore? Like an endocrinologist told me that.
Okay, so when we say you don't need hormones, that means your body is no longer making hormones. Even
Right.
if you didn't have hysterectomy, even if you still have your ovaries, after the age of 50, your ovaries are non-functional anymore, because this is where your estrogen and progesterone comes from.
Right.
So the function of the ovary will be almost gone by this age, which is usually around 50. It can be different from one client to the other, but I will say after the age of 55, you definitely you don't have any hormones. Okay, talking about the testosterone, having testosterone in female is something that's kind of pretty new, especially in the Canadian market. And we see it a lot in the US, but all of the new studies now are actually proving that testosterone can help ladies to maintain their bones, and it can help them to maintain their muscle mass. That's actually the biggest thing to help with that. It helps a lot with the energy, it helps with the sex drive, it even helps with the sleep. Especially if somebody has like anxiety for no reason and they always have this interrupted sleep for no reason, which can also be part of the menopausal symptoms. So when I do HRT for someone, I run a whole blood work that includes estrogen, progesterone, FSH for sure, and testosterone level. And then based on how you feel and based on your numbers on the blood work, we can definitely come up with a personalized treatment plan.
Okay.
Yeah. So that's for the HRT, but I always say don't look at the HRT as a treatment for obesity.
No.
So if we're going on HRT, that's a different story. That's to help with your hormones and to help with your symptoms.
Yeah.
But don't think that just going on the hormones will just help you to lose weight and you're still eating the same and no changes to your eating habits. That's not gonna happen.
Right.
Okay. So Hello, how are you? Good, good. You guys can come and join us here. So, exercise is not for weight loss. Don't think about exercise as a weight loss tool. Why is that? Because when you are exercising, especially if you're doing resistance exercise, that's a perfect way to maintain your muscle mass and to push that calcium into your bones. So this is for you to live healthy, which we highly, highly recommend. But don't look into exercise as a way to lose weight. It's a way to live healthy. It's a way to tone your muscles. And by the way, if you're losing the weight and you're not gaining any muscles, you're going to end up with a lot of laxity in your skin, which we don't want to happen. So you can definitely do the exercise that will help both. Okay. Sleep, stress, definitely big factors when it comes to weight loss because it will affect the circadian rhythm of our hormones, which we agreed that it plays a big role in the terms of the weight loss. Stress is the biggest releaser of the cortisol hormone. So cortisol hormone, we call it the stress hormone. So when we are under a lot of stress, that means we are having a very, very high level of the cortisol hormone. What can happen when we have high level of the cortisol hormone? We're gonna make a lot of fat cells, we're gonna be tired, we're gonna crash, like you're gonna have this energy, and then all of a sudden you crash. So if this happens to you, that probably means you have a high level of the cortisol level. Okay? Understanding your body and hormones. So I wanted to stress on the fact that obesity is not just linked to what we eat. It has a lot of other factors, and this is why we actually agreed on the fact that at this point we have to have medications to help with obesity. Why? Because it's not just about our diet. It's about so many other factors. The GLP-1 that we were just talking about earlier, the hormone imbalance that we were just talking about right now. There's so many factors that can affect not just our weight, but it can also affect our fat distribution. It can also affect our energy. It can affect how we look, generally speaking, and it can also reflect on our general health. So a lot of times I get this question: if I lose the weight, will that correct my diabetes? Maybe I cannot promise you that it will correct it 100%, but we can definitely minimize your medications. If you are in the pre-diabetes change, maybe that will go back to normal stage, and instead of just continue to be diabetic, and instead of staying in the pre-diabetes range. So there's so many influence on our body when it comes to those so many factors that can reflect on our weight. So insulin resistance, remember when we were just talking about the mom that's yelling all the time and how the kids were not responding? That's exactly what insulin resistance means. Food all the time, snacking all the time, insulin is very, very high. And who's listening to the insulin? Nobody. So what do we need to do? We need to control our meals into 3 meals a day. If we are able to do those 3 meals over 8 hours, that means we're fasting for 16 hours. And all through the time when we're fasting, we can drink, of course, a limited amount of coffee. We can drink tea. We can drink herbal teas, we can drink cinnamon, we can drink the turmeric, the ginger, all of the drinks that we just mentioned. All of these drinks are not just great because it has 0 calories, but it's also great to increase our metabolic rate, and it's also great for our liver. It's also great as an anti-inflammatory diet to our body. So instead of drinking juice, instead of drinking soda, we can replace that with healthy options. So this is what I was just talking about when we first started. The whole purpose is not just giving you a meal plan that you have to follow for whatever number of weeks. Come back and see me in a month, you will lose whatever number of pounds. That's not what we're doing here. What we're doing here is totally different. We're trying to change our long-term eating habits. We are trying to create a new relationship between us and the food. Because we know that when we have this healthy relationship with the food, we're only reaching out to the food that we know that it's no longer hurting our body. That's a big thing. And the other thing is I'm only reaching out to the food when I agree that I am in the time when I'm eating my meal, and then instead of snacking, I'm actually having a good full meal. Okay? And outside of my eating time, my brain will start to realize that I'm done for my day. Okay, so this is exactly what we were just talking about. And insulin resistance, by the way, is the biggest reason why people feel tired all the time. And how many people do I see in my family practice that comes to me saying that I feel tired all the time? So many. And you run the blood work, your blood work is all fine. You're not taking any medications that can affect your energy level. What's going to happen now is we need to look into a deeper vision. We need to look into the diet. We need to look at the sleeping, look into the stress level that's happening in our life. So thyroid definitely plays a big role here because the thyroid gland is one of the main reasons that affects our metabolic rate. So when the thyroid gland is underactive, which is a very, very common condition, more than what everybody thinks, one of the biggest influence that can happen is, of course, our metabolic rate will go down, and that will reflect on us putting on unwanted weight. So looking into your thyroid gland is a very important thing. A lot of times when people are doing the blood work and their thyroid is fine with the blood work, I recommend some supplements like the iodine and the selenium, for example, and some other supporters that can help your thyroid gland to function better, like it's optimizing the function of your thyroid gland more than correcting a condition if you actually have underactive thyroid. That's a different story. But having some supplements to help your thyroid gland to function at its best can also improve not just the weight, but can also improve the energy level. Estrogen is the biggest thing, of course. So this is what happens when we have a lot of estrogen in our body. And by the way, the fat cells where the estrogen is being formed. So this is why when we have a lot of fat cells, our hormones will end up being broken down into estrogen. So even in male who have a lot of fat cells in their body, their estrogen level will be higher. This is why they end up with some changes that looks feminine on them, like the gynecomastia or the large breast area in male, and a lot of other feminine changes that can happen, like even like in their hair or voice. So having fat cells can definitely equal having high estrogen level. And again, we become into this vicious circle where the estrogen is high, and then we make more fat cells, and then what can happen in the fat cells? We're going to have higher estrogen, and then it's harder to break this vicious circle. And this is why, unfortunately, one of the biggest complications that comes with having high unwanted fat cells is not just how we look, it's actually having a higher risk for so many cancers that is directly linked to the estrogen. Like breast cancer, for example, the colorectal cancer, the the uterine cancer. There's so many types of cancer that can directly be linked to the obesity. So one of the material I love to share with my clients when they come here is goals for obesity. So you probably have this one here. So those two materials, from my opinion, are very, very, very good. Finding your goal and finding your why. Those two materials, I love to share them with my client. Your goals and values, you need to set up goals. You need to set up values when it comes to my long-term weight loss journey. So why do I need to have goals? Well, if I don't have a goal, less likely I will be able to reach where I want to go. So having goals will help me through my journey. So you also have here this piece of paper that says mapping your best weight journey. So this is also another material that you guys can feel free to take home. So when I have a goal, so when I see somebody for the first time, I always say, what is your goals? So first of all, we definitely check your weight, and we also do the whole body composition analysis, so we know what is your metabolic age, which by the way can be different than your actual age. So if you're 50 years old, for example, your metabolic age can be 55 or it can be 60, which means we need to work hard to bring it down. So when we do the body composition, we know all your numbers, and we also check your weight. So when we ask clients to set up a goal, it's not just for the weight. For example, somebody is 170 pounds and her goal is to be 130 pounds, just as an example. That's completely fine. This is a good goal. But at the same time, I want you to think deeper. We want to set up a goal with so many other factors. We want to set up a goal in terms of our meals. So we will start to stick to eat a meal just like we mentioned before, and how does the meal look like? So that's another goal. And we need to set up a new relationship with the food. When do I reach for the food, and what do I eat when I feel hungry? And before I even reach out to the food, I need to stop and ask myself, do I feel hungry? And if my answer is, yes, I'm hungry, yes, I want to eat because I'm hungry, that's completely fine. But let's make a good plan. What am I going to eat because I'm hungry? If my answer is, no, I'm not hungry, I'm just, remember the high risk time, I'm bored, I'm sad, I'm mad, I'm having my friend over. What do I need to do to change this state? What do I need to come up with as a good alternative? So, for example, I had somebody who was here to see me for the first time yesterday, and he mentioned that I love ice cream. Every evening, I cannot stop eating ice cream. So my first question was, why do you keep buying ice cream?
Exactly.
If you know that this is a weakness point for you, why do you even bring it home? So he was like, because I like it. I'm like, okay, it's much easier for you to resist buying the ice cream when you're in the store, buying the ice cream, versus you bring it home and you know now that it's in my freezer and I don't want to eat it. That's so hard. That's like challenging yourself. This is the first thing that we agreed that he's gonna change. And the other thing is, I'm like, okay, why don't you come up with other healthy alternatives? So one of the alternatives I recommended for him is, I gave him this one here. This is a protein shake that's chocolate.
Oh,
Yeah, you use that one. It's chocolate, it has probiotics, it's vegan, it's gluten-free. There is nothing better than this good source of protein at almost zero sugar. I'm like, okay, you know what you're gonna do? You're gonna take this home, you're gonna make your protein shake, leave it in the freezer, and this is gonna be your next ice cream. So we agreed that he's gonna do this change, and we're not buying more ice cream. So this was kind of a good discussion between me and him, and he was happy because he's not gonna be starving himself from what he loves, but he's coming up with a good alternative that's gonna not only giving him the protein he needs, but it's also giving him the probiotics, which will help with his weight. By the way, very good probiotics, a lot of fibers, giving him basically a lot of the nutrients that he already needs. So I love this brand myself. This one, I have Ariana here, and she will be talking about the products shortly after we finish this call. Okay? So setting up behavioral goals, like I said, it's very, very important to write down yourself. Why it's important to write down yourself? Because when you see things in front of your eyes and you take a moment to stop, to write down what's happening in your brain, it's easier for your brain to understand where the problem is coming from, and it's also easier for your brain to work on it and to correct it. So there's two pieces of paper that I want you to take it as a homework. The first one is finding your goals, not just the goals for the weight, but also goals for the portion size, the meals, my eating habits, my shopping habits. These are all goals that has to be listed here. My sleep hygiene, we're also going to work on the sleep hygiene and the stress level. And the other one that goes hand in hand with this one is finding your why. Why do you want to lose the weight? So if I know why I want to lose the weight, I'm going to be able to come up with my good goals. So, of course, when I handed this to any client, the first answer I will hear is, I want to look good, which is great. Everybody wants to look good. That's completely fine. But I want you to have a deeper vision of why do you need to lose the weight. So, when you write down here your why, I want you to think deeper. I want to look good, that's a perfect why, but this cannot be the only why you have. You also want to think about your general health. Are you trying to lose the weight because you don't want to be diabetic? Are you trying to minimize your chance of having heart attack, a stroke? Are you trying to avoid knee replacement surgery? Are you trying to go upstairs without being short of breath? Are you trying to enjoy more time with your family? So if you have all of these whys, you need to write them down here. And you know what you want to do with these two pieces of paper? You want to hang them on your fridge or on your snack cabinet or somewhere in your kitchen. Dangerous areas where we all reach out to the food, and we need to remind ourselves every single day that now we have goals and we have a reason. When we know that we have a goal and we know what our goals are, and when we know that we have a reason and we know what our reasons are, we will be much more successful in our journey, mapping your weight loss journey. Okay? So it's all complementing each other. Okay? I hope you guys find this is good so far. Okay? Perfect. Any questions? Continue on? Okay. So, appetite system, brain's role in hunger and thirst. Okay, so that's another one here. There's so many factors. I don't know if you have this one. I think you do. So, understanding your factors that can affect obesity. So, we already talked about the activity, the sleep, the hormones, the stress level, not just the eating habit. So, just because I don't want to take so much of your time, I want to share a few points with you. Okay, so this is a craving. It's a good thing when we have the high risk time of the day. It's a good idea for you to write down what you crave, and it also allows you here to circle what time of the day. Most of the time it's in the evening. Nobody has craving in the morning. I mean, I only heard it like maybe twice that people will have craving in the morning. But coming up with a good alternative will make our journey a lot more successful. So for example, I had this one client who said, I cannot stop buying chips. You cannot make me stop buying chips. In the evening, this is my own time. I want to sit down, watch TV, and eat chips. I'm like, okay, so if you like salt, let's come up with a different alternative. Why don't you eat pickles? So she was like, oh, because I didn't think about that. I'm like, okay, just make sure that your blood pressure is okay, right? Because I don't want to recommend something that will drive your blood pressure up. But if you're eating chips, that will drive your blood pressure up anyway. So I'm like, okay, let's come up with an alternative. So she started to do that. She started to cut the pickles into thin slices. She does that. So how many calories does the pickles have? Barely any, because it's cucumber and the salt.
Yeah, that's right.
And a little bit of vinegar. Of course, everything has to be in portions, but this can be like added to your evening meal, and then that's it. You're still like feeding this craving inside you, because keep in mind, what's the best diet in life? What is the best diet in life?
Healthy diet.
The diet that you can maintain.
Right.
If I'm giving you a very, very strict diet that you're gonna follow only for a few weeks and then you stop, regardless of how good this diet is, you're not gonna be able to maintain. So what's the best diet in life? The diet that you can maintain. So what we're trying to do here is we're trying to personalize your meal plan. That who's making this meal plan? You. Why? Because this means you will be able to maintain it. Because you know yourself and you are the best person to come up with this meal plan. We help you to know what to put in the plan and what to take away from the plan, but you are the one who's suggesting your own plan. Of course, if you need help with some meal plans, we will be more than happy to offer this to you. But honestly speaking, when we go through all of this education with the clients, they say, no, now I know what to do. You don't need to give me any meal plans. I can do it my own. So we're gonna do a very quick game, and then I'm gonna share a few points with you, and then we will be listening to Dariana. She's gonna be talking about some supplements that I find is just so important when it comes to our healthy journey. I usually don't call it weight loss journey, by the way. I always call it healthy life journey. Why? Because we're not trying to help you to lose the weight as much as we're trying to help you to live healthy and to minimize your complications in case it happens, help you to live healthy, minimize the chances of having so many types of cancer, joints pain, back pain, all of these conditions that can be directly linked to the obesity. Okay? So let's do this game very quickly and let's have a nice group discussion. So low estrogen always cause weight loss. What do you guys think?
No.
The opposite, right?
Yes.
Insulin resistance make it easier to gain weight even with small meals.
Yes.
Thyroid problems can affect weight, energy, and mood.
Yes.
100%. Testosterone only matters for men, not women.
False.
It's false. It's actually a big myth that a lot of the new studies are trying to prove it's totally the opposite. So let's just go through that. So definitely low estrogen. Estrogen is definitely having a big impact on our weight, and the insulin resistance makes it easier to gain weight, unfortunately. So what do? We need to correct the insulin resistance, and that's through going through a period of time. There is no insulin stimulated, which means there is no sugar intake. Okay, so eating or drinking anything that has sugar, unfortunately, can break the fasting. Okay. One thing I love, by the way, during the fasting time is the fizzy water drinks. And you know what you can also do? You can add some mint to it and make it like a zero sugar mojito.
A fake cocktail.
Yeah, exactly, right?
Sometimes you can have the real thing, but
every now and then,
yeah, exactly. You can't
it's
stop
okay.
Everything, right?
Well, we're talking about what we can
Yeah.
do every day to feed the craving, because the whole point is we're trying to avoid feeling starving. Like, you don't want to starve yourself.
Right.
Remember what we said earlier? When you're starving yourself, this is where you're making the bad choices. You're heading home super hungry, or even worse, when you go shopping. Okay, so one of the tricks I always talk to clients about: never go shopping when you are hungry.
That's it.
Please do not. Because they're gonna go put everything in your grocery cart. So few things. Never go shopping when you're hungry. Actually, one of my clients shared a very good experience with me, and I loved it. She said, I stopped going grocery shopping. I only do online shopping. So she said, it sounds like it's more expensive, but actually it's not, because when you're doing your online shopping, you're only buying what you need. But when you're actually physically in the store, you're picking up everything and putting it in your cart. So you're buying a lot more things, you're paying a lot more, and you're getting so many unnecessary things home. So this is a big thing. So never do shopping when you're hungry. And maybe let's try the online shopping for a little bit and see if that would even work better for you. And the other thing is, if it shouldn't go in your mouth, it should not go in your grocery cart. So go back to the ice cream. Why do you even buy the ice cream? The bag of the chips, the cookies, this and that. Why do you even bring it home? Why do I bring things home? And I know that it's in my fridge, or I know that it's in my cabinet, hidden in the cabinet, and I know where it's hidden. And now I have to fight with myself in the evening, not to reach out. What's easier? To fight with yourself in the store, saying, I'm not buying this, or bringing things home, and then you're telling yourself and your family that nobody's touching this bag of chips. Why are you bringing it home? So it's much easier to control our diet by controlling our shopping habits, which, by the way, is one of the goals here on this setting up your goals, behavioral goals. Is one of the things that is good. So this should be one of our goals, doing better grocery shopping. Okay?
So I have a question.
Sure.
The kids sometimes, they need snack on the break. I can give it to my son, he's 11.
Let me actually get Dariana to answer this question.
Okay.
Is it safe for 11 years old? Because some of the protein shakes has a bit of sweeteners that should not be given to kids. So I will ask her if that's okay, and if this one is not okay, maybe we can try to find an alternative that can be good for his age.
I think with stevia, you can.
Maybe we will ask, okay, so Dariana's here, so maybe we will get her to answer this question. Let me introduce Dariana to you. So Dariana actually works with Genestra company, and she also works with the Garden of Life company, which I love their products because they have very, very clean and good quality products. So Nasreen has a question regarding the age limit for the protein shakes for her son who's 11 years old.
So absolutely, a younger person most certainly could use a protein powder. We know that there are some directly marketed for children. What we're looking for is clean ingredients. We want to make sure that whatever they're putting into their little bodies is as minimally processed and as clean as possible. So sourcing matters most here. So when I think about a little one, I also think about my children. So I'm thinking, how are they sourcing that protein? So is it a plant-based way or a plant-based protein, or is it a way, where is it from? Now let's look down into the non-medicinal ingredients. What is in there? What's giving it that flavor? So once you're able to kind of crack it open, and if you're seeing ingredients that you'd be comfortable serving in your kitchen, so perhaps there's some monk fruit or some stevia, then that's most certainly something that you can have and share with your young one.
Okay, so that's a good news. We can share it with kids safely, knowing that it has good ingredients that we already offer at home. Let me ask everybody at this point if anyone has any questions so far. You guys are good?
ممكن عندي بعض questions.
Sure.
Okay. فيني أسألك إياها بالعربي؟
Okay, that's fine.
كمان عامل مثل ما عم تحكي عن الاستروجين عم بحس إنه صدره عم يكبر وبطنه شوي فأنا خايفة ما بعرف شو أعمل.
Okay, so that's the same exact thing that we were talking. So the screen was asking about the changes that can happen to her son. And that could be because of the unhealthy eating habits and the snacking all the time and having the high level of estrogen and insulin that will reflect on making more fat cells. So it all gonna come back to stop the snacking, stop the sugar that's building more fat, and the fat is where the estrogen is being broken down, like it's actually being made from the testosterone that's being broken down in the fat cells. So it's all gonna come back to the eating habits. So we, before we take away the food from them, we have to give them a good alternative. Because if I'm saying to my son, okay, you can't eat this anymore, yeah, that's okay. You cannot eat this anymore, then the first question will be, what should I eat then? What should I take to school? Like, I have to find a good alternative, and these good alternatives will be the best way for us to do it as a longer term plan. So that's exactly what we were just talking about. So I'm gonna actually just finish with, this was the very last thing, so we're gonna go directly, literally to Diana now, but just a few points I wanna make sure that everybody's aware of. When we do the fasting, or when I finish my last meal, a good trip I find that is also helping as well is brushing my teeth. So remember we said that brushing my teeth after my last meal tells my brain that I'm done for my day. That's one thing. The other thing is, don't go shopping when you're hungry. Try the online shopping. If it should not go in my mouth, it shouldn't go on my grocery cart. So let's focus now on healthy shopping, and let's focus on what we bring home. Let's focus on the healthy snacks that has like less sugar. Maybe we can try to make some snacks at home that can also be like homemade, so it doesn't have any added sugar. Don't eat any, if you like fruits, eat the fruit. But don't squeeze the fruit and drink the juice. Because when you are doing that, you are basically getting rid of the fibers, which is basically the healthy part. And think about it this way. How many apples, for example, do you need to squeeze to come up with a 1 cup of apple juice? At least 4 or 5. Who can eat 4 or 5 apples a day? Nobody. But you can drink the juice of 4 or 5 apples in literally 5 seconds. So you're getting rid of the good part, the healthy part, which is the fiber, and you're only getting the sugar. And you're not getting the sugar of 1 apple, you're getting the sugar of 4 or 5. So think about it this way. If you have this like juice squeezer, you want to stop using it, and you want to eat the actual fruit instead. Okay? So I hope this was helpful, and I will love to hear the feedback of each one after this talk here. We have some testimonials from our client that I will also bring up here, and I will have it ready as soon as Zariana finishes. So you can just start now, Zariana, and she has some good things to share with us regarding the probiotics and regarding the protein shakes. Because I find that, again, like having a good alternative is one of the main keys that makes the change successful. Because if I'm asking you to restrict your diet without giving you a good option to replace the diet, it's not going to work. At least it's not going to work on the long term. Okay? So thank you so much for coming in today.
Oh, my pleasure. Welcome. Hello, everyone. Today, what I thought I would do is, well, first and foremost, say this was a wonderful talk, and Dr. Beshay, it was
Thank you so
very
much.
holistically approached in terms of total body wellness, not just looking at the physical weight loss. And I loved that listening in the other room.
Thank you.
And today, what I thought I would do is really speak to supplements and how they are truly meant to fill in nutritional gaps that we may be losing in our daily diets, but also how to use them to unlock kind of metabolic pieces that we're looking to better understand. And first and foremost, what I wanted to start with is just talking about protein. We talked a little bit about it here, about protein in little ones, but who here thinks about protein as a filling food? And as a food that if they have it and they start their morning off with some protein, perhaps a protein shake or some eggs, and maybe some avocado, some healthy fats, who feels like they've set themselves up for success for the day.
Yeah.
Right? And so we're busy. I'm a mom of two little kids, 2 and 5, and I can certainly tell you that it's go all the time. And I find that in living in a modern world, in modern life, convenience is very helpful. And meeting my protein goals is very helpful. And I'll answer to why that is. But also making sure that I'm doing this to support my blood sugar is helpful, because we are living in a go world and our stress chemistry is activated. We're always chasing something, right? And back in the day when we were hunter-gatherers, we were literally being chased by bears and lions. And today that bear or lion is in here. It's with work. And so managing our stress and managing our meals is so important. And you'll see why in a quick moment. When it comes to protein and satiety, so that means a feeling of fullness, protein is doing a couple of things in any metabolic journey. First and foremost, it's helping to maintain your muscle mass. We want to make sure that we're maintaining our muscle mass, because where the body is going to be looking for those building blocks of life is going to be your muscle, as we're on a calorically restricted diet, or perhaps we're being mindful of what we're putting into our bodies. So maintaining our protein is key. The next piece to this is that protein is thermic. Thermic means, as we know, there are some foods that have this fat burning or fat kind of boosting quality to it. Protein is the number one thermic food or macromolecule that we can put into our bodies. So loading up with protein is essential. Food source, food is best. Always feed yourself. But going back to being a busy mom, we're working. How are we making sure that we are getting that protein in consistently through the day? And that's where protein shakes would come in. And then if we're looking at the quality of the protein and what the protein is going to be giving us, that's the next step. Because there is a wide range in the market of protein. And if you have questions about that, I'm happy to answer them. But there's a wide range of quality. And what I want to put in is good quality proteins. I don't want them to bloat me. I want them to fill me. I want them to taste delicious. I don't want them to be gritty. I want to feel like I'm also treating myself. May that feel like the ice cream for your patient.
It's not a punishment.
It's not a punishment. But also imagine maximizing your nutritional density, because it's not just what you're eating, it's the inputs. And if we truly thought of food as information that we're putting into our bodies, because ultimately that's what it is, we know that we're then downstream as we think about all the processes in the body that we were supporting. We know that we're getting those benefits. So if I'm on the go, that's in my thermos. And I'm making sure that I'm shaking it up, and I can do it with water. I can do it with my choice of milk, nut milk, and it tastes, this one particularly tastes like a pudding. It's delicious. I want it to feel creamy. I want it to feel good. But the next thing I want to do is take it and I want to feel full. I don't want to feel hungry in 30 minutes. And do you know what that is? That's called a postprandial blood sugar spike. That means after you ate, your blood sugar goes up. And Dr. Beshay was talking about protein, fiber. Why do we take them? We also take them to manage those blood sugar spikes because we don't want these wacky waves.
The instant spike that we were just talking about.
We want to coast. We want to coast. And that's what you're going to be getting when you're taking protein consistently through the day. So it has an insulin protecting effect in terms of our blood sugar protecting effect. So we're not only supporting our muscle mass, we are supporting our blood sugar, we're controlling our cravings, and we're also supporting any type of rebuild that's happening. So if we're leaning into movement, if we're leaning into weightlifting, if we're leaning into any of that, we're also giving all those building blocks. Now, protein, but give me more. Give me more. We want good quality. There is a wide range. We can go to your average farmer and get whey, and then we can go to Ireland and we can get just about what we're eating. It's what that animal that we're consuming, what they ate, because those messages are coming through. So that's where the Garden of Life specifically. So if we're looking at the whey, these are Irish cattle that lived most of their life on green grass and pasture, eating a biologically appropriate diet. We're also getting all of those third-party certifications. I want to know it's organic. I want to know it's non-GMO. I want to make sure that all of those boxes that I would typically shop are ticked off.
Especially if we're going to feed our kids this protein. And by the way, I started to give my kids, well, my kids are a little bit older, protein shakes because I find that this is a great way to get the appropriate amount of protein. And a personal experience here is if you are busy and if you are on the go, if you don't prepare a good healthy meal for your day, you're going to end up snacking on unhealthy options.
2 o'clock blood sugar spike.
Yeah. So
it happens. And what you can do is prepare for it.
Yeah.
And that's how we are anticipatory in our behavior, but we're also setting ourselves up for success. So that's something that I wanted to share with you in terms of whey. Why whey? Whey would be very quick. Whey is low fat, and whey is quickly absorbed into the tissue, and it also gives you that creamy goodness experience. Now, whey comes from milk, so if you do have sensitivities to milk, then we would want to test this out and see how you do. But it is absolutely a delicious treat. Can you throw it into a Ninja Creamy? Yes. Can you make it into pudding? Yes. You can do all of those things.
You know what I also do? I actually do pancake with the protein powder.
You can bake
so you know that. So coming up with healthy options. So that's what I do. I add the protein powder to the pancake. So instead of just using regular white flour that we don't want to use for our kids, I add protein, I add a good taste, and you don't need to add maple syrup because it already tastes very delicious.
So in terms of sweetens, we're sweetening with stevia, and stevia is one of our natural sweeteners that we can use that isn't going to have as promoting of an insulin response. So blood sugar is not going to be flooded with all of the sugar to kind of mop up with insulin. So that is also very helpful, and it doesn't hurt that it tastes like a pudding. Now, for those that are sensitive to dairy, we have an all-in-one. But why don't we do all-in-one plus? All-in-one means that you're not only getting branched chain amino acids. These are really focused on, for those that are leaning into lots of movement, lifting heavy weights, so important as we get older throughout our life cycle. So if we're lifting weight, we also want to make sure that we're getting those branched chain amino acids. Those are targeted in here. L-glutamine. This is an amino acid that is so healing to the gut epithelium. Have you heard that term before? The lining of the gut. So the gut epithelium very much healed by glutamine, but it's also promoting satiety, feeling full. In fact, and I'll give you a little biohack from naturopathic medicine, and that would certainly be that you can swoosh with glutamine, and that will also help with curbing your cravings. So there's glutamine in each of these, and there's also a probiotic. So probiotics here are very important, and I was going to get on my my trail on to probiotics, but I'll keep it very brief here when I'm speaking to the protein. Some proteins make you bloat. Some proteins don't make your tummy feel comfortable. So this is where a probiotic can not only be helpful, we also want it to be functional. If we've got 2 billion of this particular BLO4 strain, it's going to be also helping with your immune health. Now, who here has heard about the immune system helping or interacting with our gut? The gut. Well, if I told you that most of your immune system is kind of here, that's makes sense, right? And we know that when we get unwell, sometimes there are tummy symptoms. These particular protein powders have, probiotics in them, and they're not only going to be supporting healthy immunity, but also your recovery. You may notice you're not getting sick as often. So that's always an added benefit. So we're going to decrease the bloat. And when it comes to the all-in-one, these are legumes that were treated very well. And I'm not sure if any of you have thought about legumes and think, oh gosh, any pea is going to make me bloat up and I'm not going to be comfortable with that. The way Garden of Life handles their peas, they do so in a process to minimize that bloat and discomfort. So that's the all-in-one option. And there's a serving, not only a serving, a whopping serving of fruits and vegetables here. So we're also getting our greens and our phytonutrients. Phytonutrients are so important because we're not only getting our nutritional density, we want to make sure that we're being able to capitalize on every kind of spoonful or drinkful that we're getting, that it's giving good information. So putting in some greens here is very helpful because we know in a busy lifestyle, we probably aren't having as many vegetables as we need. Question?
So the whey protein it's a pea protein?
The whey would be dairy based, so that's milk from Irish cattle, and this would be a
so it's a
pea.
bovine. Okay.
Mm-hmm.
Oh, and that one's
This one is no. It's not.
right.
It's vegan. It's completely vegan.
This one is vegan.
Yeah, and the other one is
A dairy based.
yeah.
And now you definitely have options, or you can kind of lean into one or lean into the other as you choose, because we don't want to eat the same thing every day. And in fact, I know many people who take, every other day because sometimes they want to have extra greens. Perhaps today was a day I just didn't eat enough of my greens. You have an option now to really capitalize on the nutritional density of a food like that. Consider that an all-in-one meal.
Mm-hmm.
Yeah. So that would be from Garden of Life. Now, so we talked about blood sugar stabilization. We talked about satiety. Do you know that protein itself can stimulate? I know everyone talks about GLP-1s, Dr. Beshay, but GLP-1, there are other satiety hormones or hormones that signal that you're feeling full. And this would definitely be the number one way, which is with protein. So that is definitely something that I would consider. And also when it comes to supporting not only the inside out benefits, but looking at collagen as well. Protein is meant to be a full spectrum of amino acids. That's what you're getting when you're taking the protein powder. Collagen, I'm sure everyone has heard about collagen, their favorite collagen in the market, or they're seeing influencers on social media speaking to collagen. Collagen powder is not complete. But what collagen powder does is it gives you a plethora of glycine and proline and collagen peptides. Peptides are the building blocks of proteins. And in these two peptides, we have the opportunity to not only get some protein, but we can also now support our joints, our skin, and how our skin is responding to the weight loss. If we're exercising, it'll help with recovery. And we can also do so many other functional things with collagen that sometimes protein may not fit into, but you can throw, for example, collagen into your tea. And you can get 10 to 20 grams of protein. And you've now hit you're halfway there to hitting the protein goal for the morning. And that's just with one scoop. It can go into your tea, it can go into your coffee, and you have absolutely no flavor. It's completely tasteless. And if you're thinking about beauty, if you're thinking about cosmetics in any way, it'll help with the elasticity of your skin, the bounciness of your joints, the health of your gut, because we also want to support the gut. And glycine is a calming amino acid, the neurotransmitter in the brain, and it gives us a sense of calm. So if you're looking for a way of not sedating, but feeling calm and productive, collagen is definitely one to think about. And I know I was alluding to stress and then the day-to-day buzz, but I'd like to leave you with two other pieces here. Our guts are talking to us. Our microbiomes, they communicate with these little text messages, these chemical signaling molecules all the time. Some of those chemical signals can be, I'm hungry and I'm craving sugar. Sometimes it can be that I'm stressed. So if that's happening, I would like for you to think about the fact that supporting a healthy microbiome, not only with real food, but also with probiotics, putting the right bugs into place, is really and truly about whole body health. And I'm specifically going to mention that the 4 core strains in the HMF are not only well studied, we've got over 35 years, we've got clinical trials, and we can also show the broadest range of health benefits. If I'm going to take something and I'm going to put my money into it, I would love to see that it's going to be giving me benefits that not only I can see on a day-to-day basis, but also that I can feel. So that's where a quality probiotic with good, rigorous study behind it, and also we want to see some benefits. I want to see that I'm not going to get as sick as often. I want to see my bowel habits improve. I want to see perhaps that I have a reduction in cravings. These are all possible with probiotics.
Especially it's already flu season now. We want to make sure everybody has a good immune system.
Yeah. So when you feed the right bacteria, so bifidobacteria being one of them, I'll give you this to think about now so you can start Googling it. Bifidobacteria, when you feed them the right foods, they will release a short-chain fatty acid. They actually release multiple: acetate, propionate, and butyrate. And those messages, chemical messages that are produced by our microbiome, they speak to our mitochondria, those fat-burning cells of our body. They speak to the brain. They can give you satiety or I feel full cues. And this is all coming from the gut. And if I told you that there is a highway directly relating from your gut up to your brain, those messages via the vagus nerve, you could know that intuitively, because how many here have been stressed and they may have a not so good experience in the washroom, right? Our stomachs and our minds are intimately connected. So taking care of gut health is really and truly about taking care of whole body health. So that's the probiotic piece, and I'll leave you with magnesium. I heard lots today about insulin. And so I'm going to speak to the fact that magnesium is a mineral that we just don't have enough of in our diets. Our food supply has changed a lot. And when we have a limited amount, we have to go after it. We have to seek it. Whether that is in leading into lots of greens, or we're going to be taking it in supplementary form. It's involved in over 300 reactions in our body. And one of them is making sure that we improve our insulin sensitivity. And that will translate to improved craving kind of management.
I actually didn't realize that this is gummies. So I find that gummies are always like good to satisfy this like kind of candy. In our body. So it doesn't have any amount of sugar here, but I will think that there is no sugar added here.
So I work for a company where we're not only looking at supporting practitioners, naturopathic doctors, medical doctors, chiropractors, but we're also looking at the patient. And we're making sure that if you're going to be leaning for a gummy, your gummy is clean. Your gummy doesn't have sugar. If you're going to be taking your gummy and then leaning towards like a sugary drink because your blood sugar has been spiked, that's not helpful for health.
Sure.
But we want to make sure that when you're taking your supplement, you're enjoying taking it. There's compliance to taking it. So you can actually enjoy that and make it a part of your lifestyle. Longevity is everything. Magnesium also helps with movements. So if we are not regular, magnesium can be beneficial for making sure that we do what we call phase 3 detox, which is the removal of waste from our bodies. That is also very, very important for good health. So there are different forms of magnesium, and if you have any questions about the form and why you would take it, I'd be happy to answer that. But know that we are missing it in our food supply. And where would you get it? You would get it in your greens. So in every plant, when you think about chlorophyll, the same way we have iron, and there is hemoglobin, and at the center of every hemoglobin is an iron. At the center of every chlorophyll in a plant is a magnesium. Mm-hmm. So, and if you're not getting a lot of greens, we're certainly not getting enough magnesium. And then we're not getting enough to have a therapeutic effect. We want to sleep better. Better sleep means that we're relaxing, getting deep sleep, which is quality sleep. We're not just cycling in the lighter kind of phases of sleep. And that stress chemistry would impact how your blood sugar responds and also your cravings for the next day. Magnesium at night is very, very helpful.
So that's a nighttime magnesium?
This isn't every time magnesium. It's a magnesium citrate. If you're looking specifically for a calming magnesium, because elemental magnesium is calming, the glycinate bound to magnesium is very calming. That's the form. And it also would help with muscle cramping.
Of course. And sleep. One thing I like about collagen is, remember when we said that we don't want to go home very, very hungry? We want to tell our brain that we're full before I make it home or before I go for my grocery shopping. I find that this is a perfect way to do that because you can add it to your water before you make it home. You can add it to your tea, coffee, whatever.
It's delicious.
And the protein, same as the good fat, will go to our brain and will tell my brain that I'm not super hungry. So that way I will be able to make a better choice. So I personally find that, this is my personal, people who are always busy during their day, they don't have time to sit down and eat an actual meal, which is like myself. I don't usually take a lunch break, so I only have like few minutes to eat something in between, so I cannot eat like a good amount of greens, protein, and everything in like 5 minutes. This is like a perfect way to satisfy my protein intake, avoid eating unhealthy snacks, and at the same time getting all the benefits in one cup. That's my personal experience. When I have the time to eat like a whole meal, that's amazing. It doesn't happen very often, so this is like a perfect way for myself, and I'm sure that a lot of us are always busy. We don't have time to have this perfect meal, and kids, it's a perfect idea. Thank you so much, Tariana, for explaining that. So I just want to go through this very briefly. Thank you. We have lots and lots of testimonials as we've been running the weight loss program for quite some time now. And actually, some of the people who are here and our lovely online clients, a lot of them are actually our weight loss clients. So I would love to hear their feedback if they want to. But we got lots of testimonials here, and a lot of people. I don't know if we can actually play this, Randy, just very quickly. So I promise we only have a few minutes left, and then we're done.
I'm here for the weight loss program. I've brought a few of my friends here, and we're all gradually losing weight over the month. Some are down 6, some are down 12 pounds. I'm not sure how much I'm down yet, but I'm gradually getting better. I have more energy. The staff here are excellent. They're great to deal with. Price is reasonable. I would recommend coming here for male or female for many different reasons. And, I think that would be good for people to do.
I am really pleased with my weight loss program that I have started. I am a patient of Dr. Beshay to start with, so I knew about this place. They are offering a wonderful program. It's $56 a week, and in 3 weeks I've lost 8 pounds, which I am so pleased. I had tried to lose weight on my own before this program, and just couldn't do it. I'm finding as I get older, it's hard for me to lose the weight. With this, it made it easier. I just had less appetite and more energy. And I noticed even my skin is going, it looks better. My body, how it's feeling better. That I get into some of my clothes that I couldn't. I would say to anybody, this is a great program. Try it.
Okay, and we have lots of our online as well as in-house reviews here and testimonials. So I would like to thank everybody for coming in today, and I hope that you found this webinar helpful. And if you have any questions that you don't want to ask in front of the camera, I will be more than happy to answer after we finish here.
There's two more testimonials if you want to watch it.
Okay, sure. Do you guys want to watch that?
Sure.
Okay, sure.
Hi. So I'm just
sort of midway on my weight loss journey, but I found it out on Facebook for the weight loss program, and I've been into it 5 weeks now, and I'm down 19 pounds, which I'm happy about. It's absolutely a comfortable place to come. You don't have to worry about being embarrassed about anything or anyone making you feel uncomfortable. It's a welcoming, comfortable atmosphere. And I loved everything so far with the weight loss program, that I did a couple of other treatments as well. So I will see you in about 4 more weeks. Thank you. Hi there, I'm back. I did a testimonial about in April when I started the weight loss program, and now we're into October and a total loss of 38 pounds. It's absolutely seamless, flawless, absolutely the easiest thing I've done to lose weight ever. I would do it again.
So we focus a lot on not just the weight loss, but the fat loss and tightening the skin. Let's agree that weight loss doesn't usually help us to lose the fat, because we agreed that this fat is hormonal, it's stress related, it's insulin related, so many other factors. And even when we lose the weight, without focusing on breaking down the fat cells, the fat cell doesn't disappear. It's still there, but it's just shrinking. So it's just waiting for the weight gain to happen, and then it will just like blow up again. So what we do here is we definitely focus on the fat loss beside the weight loss. So, and by the way, the treatment we do in terms of injection or laser or radio frequency, you do not see the results right away. Like, it takes quite some time for the actual collagen production to happen and for the actual fat cells to be like broken down completely. So these results we see here is definitely not the final results. It actually gets better with time, because with time, like at least 4 weeks after the initial treatment, like we take the picture at the same time of the treatment, so you don't really see the final results. It gets better 4 weeks later when the actual fat cells are completely broken and when the skin is even tightened more. So do we have any questions from our online friends?
Give me a second.
And I will also like to get your feedback from Angela, Victoria, and Kim, and everybody who joined us. I would love to get your feedback, and please let us know. Oh, thank you so much, Angela. She's so sweet. She's clapping her hands. You're always sweet, but please, if you also have any topics that you would like to discuss next time, please let us know. We are hosting online and in-person educational event once a month now. So every month we do educational topic. Last month we had the female sexual wellness. This month we're doing the weight management, which is this event that's happening today. A lot of ladies actually requested from me talking about the menopausal changes and the hormonal imbalance. So that's going to be a good topic to talk about. But I would also like to get the feedback from everybody. So I want to make sure that whenever we are discussing a topic, it's actually important to you. So it will meet this pain point that can be bothering you. So if you please have any recommendation, you can feel free to let us know, write them down. You can email us. You can always leave a comment on our Instagram or Facebook page. Like, you can even text us 705-712-3737. There is so many ways to reach us. Okay. So I think we don't have any questions.
We had one from Gillian. He asked, sorry, give me a second. How does your weight loss program differ from other weight loss programs?
So I wouldn't be able to talk about the other weight loss programs, but I can talk to you about what's included in our program. So what we do here is we offer basically all of the advice, just like what we talked about today. We explain to you what you need to do in terms of changing your diet and when we eat, what we eat, the quality of the food, the grocery shopping. We share a lot of materials with you. And on the top of that, we also offer you injections that helps you with the weight loss
journey. So for example, we do the glutathione injection, which is going to be included and developed in the program. Glutathione, if you guys remember, we mentioned that this is the best one to target your visceral fat because it's not easy to get rid of the visceral fat. And remember, we said there is a direct link between the amount of visceral fat we have and the longevity, which is how many years we can live. So we don't want to just live longer, but we want to live healthier. So we do the glutathione shots, which counts a lot with the visceral fat, the skin, the immune system. We also do the MIC shots. The MIC shots is MIC B12, it's all in one shot. B12 is great to help with your energy level, but it's also amazing to boost your metabolic rate because part of the problem why we put on the weight is our metabolic rate goes so low. So B12 will help to boost your metabolic range. It will help with your energy. The MIC component will actually help a lot with the fat metabolism, so that will also help you through your weight loss journey. We also do other shots that not necessarily it has to be involved in the weight loss, but we do the net loss, we do the vitamin D shots, we also do the biotin shots, because one of the things that can happen when we lose the weight is the hair changes, like our hair, we can lose more hair. We want to make sure that you get all of these nutrients. If you need to be on prescription for GLP-1, like semaglutide, for example, we can start you on the medication if needed. This has to be one-to-one assessment. Not every client who joins our weight loss has to be on a prescription medication. This is something that has to be decided when we see you and when we know your goals exactly based on how many pounds you need to lose. Another thing that's also included in our weight loss program is the injections, the lipolysis, to break down the fat cells. Remember, we said it's very important to break down the fat cells if we want to lose the fat cells permanently. So we give you the injections that goes right into the unwanted areas of fat, which can be like your stomach, your inner thighs, your outer thighs, like your cellulites, your arms. It can basically target any unwanted fat in your body. And this is super effective. I personally had this injection and a lot of people are asking me now, how did you lose a lot of your stomach fat? And that's because of the lipolysis injections, because losing the fat in these areas in particular is very, very challenging. Another thing that's also included in our program is the laser treatment or the radio frequency, whatever you prefer, or we can do both. The laser and the radio frequency both are amazing ways to continue to break down the fat cells with the heat. And it's also great to tighten the skin, because it's very, very important as you start to lose the fat to tighten the skin, because otherwise you're going to start to have, excuse me, hanging skin, which is not going to look nice. So we offer you this as well. One of the things that we love to do as part of the program is the body composition analysis. The body composition analysis, this is usually on the first day. When you come here to the clinic, we do a whole assessment. And this assessment includes a whole assessment for your whole body, not just for your weight, but we know about your BMI, your total mass, body mass index, fat amount, visceral fat, superficial fat. We give you a metabolic age. We also do skin assessment, because we also need to have a baseline of your skin when you first start, before you start losing the weight. And when you started to lose the weight, we can repeat the skin analysis and then we can see what changes you will have. Some of the programs also include IV. It depends on which program you will join. We have 3 programs to join. So one of them actually includes IV, which is another amazing way to increase your metabolic rate and increase your energy level. Now, another good news that I would like to share with everybody, we're also getting an exopod. And the exopod is like a bed where you sleep in the bed. And this bed is on Himalayan salt, and you have the infrared light, and you have vibration, and you have a lot of muscle stimulation that will be happening. And you're gonna get lymphatic drainage, detoxification for your body. It helps a lot with the losing inches and detoxing your body. It helps with the energy, so it's helping with amazing results. So one of the things that we actually decided to do today is anybody who's signing up for the program we're gonna give you a free pod session to try, just as a complimentary one, because we would like everybody to try that and get the benefit of the exopods. So that should be in within 4 weeks estimate from now, but if you sign up once we have it, we're gonna have your name on it and we will be happy to give you these sessions, okay? So I hope this answered his question, how our program is different than others. So basically what we try to do is we try to cover all of the topics in terms of the weight loss, in terms of appetite, increasing your metabolic rate, visceral fat, fat cells, superficial fat, tightening the skin, assessing your skin with the body composition machine. So basically we try to cover everything. If there's anything missing that you felt like you wanted to see in our program and it is not in our program, I would love to hear it because we always love to improve what we offer.
I have a
Yes,
question.
sure.
Do you guys provide like a working out plan or like what I should be doing or like
In terms of
exercises?
we can sign you up with a program. It's called Constant Health. They give you this workout plan as well as part of the program. If you're looking for that, yes, yeah, yes. Okay, perfect. Any other questions? You guys are all good? Okay, so thank you so much for coming in. And if you have any questions, feel free to reach out to us. And this talk will be uploaded to our YouTube channel. So if you want to go back to watch it, you can definitely feel free to do so. Okay, great.
Thank you.
Thank you.
Thank you.
Thank you.